Hello, my name is Shanika Hampton, and I'm a certified athletic trainer looking to compare the effectiveness of two types of treatments in my comparative effectiveness course at AT Still University. Specifically, we are going to be looking at how to compare or see if positional release therapy treatment is going to be better at treating hamstring injuries than proprioceptive neuromuscular facilitation stretching. So just to give you a little bit of a background of what we're going to talk about in this project overview, we're going to be addressing the conceptual framework for a type of research project that looks at these two types of treatments, and that is going to be specifically addressing the lack of muscular flexibility that can occur in both chronic and recurrent hamstring injuries. So again, specifically, we are going to look and see which treatment is better. Then we're going to address the clinical plan that you can develop when you're trying to compare those two types of treatments. And then lastly, we're going to look at how significant this type of research is in athletic training and how feasible it is for athletic trainers to conduct this type of research. And we're going to refer to this research as the point of care research. So when we address the conceptual framework of the research project at hand, we have to look at the topic and how it's relevant in athletic training. We all know as athletic trainers that hamstring injuries are very common in our setting. Hamstring injuries are going to be one of the most common injuries that we will tend to treat. That's going to be next to ankle sprains, stability issues of joints. So a lot of those things are common, but hamstring injuries are right up there with the rest of them. When we look at the epidemiology of hamstring strains, we actually found a study in 2015 that was conducted by the NCAA Injury Surveillance System where they looked at all of the injuries of that year. And it was shown that 1 in 12 hamstring injuries occur in the most common sports of soccer, track and field, and football. And it was actually shown that 1 in 12 of those injuries were chronic or recurrent in nature. And so hamstring injuries are pretty common if there's 1 in 12 of them happening per year. Okay, so the commonality that we see with all three of those sports producing hamstring injuries is that those sports all involve heavy running, cutting, explosive movements, quick deceleration movements that put a lot of tension on the hamstring muscle, the muscle, and more specifically, it's going to be producing forceful contraction and even eccentric tensioning. So you can see how there's going to be a lot of issues that can arise with hamstrings just from the nature of the sport in general. Okay. But as we continue to talk about the conceptual framework and how you build such a research type of plan and study, we have to address the common problems that you are going to see with hamstring injuries and the symptoms that are associated. So typically, you guys would tend to see an athlete reporting with limited ability of motion in their hamstring muscle. They're going to produce or complain of a lot of pain, just lack of flexibility, and not being able to fully execute their sport-specific movements. So anytime we're developing research of any types of treatments, interventions, anything of that nature, we always want to organize our formal question into something that we can truly focus on and hone in on. In this instance, using the PICO format, the population that we're going to be dealing with is going to be athletes with, again, chronic or recurrent hamstring injuries. We're going to be looking at two interventions, both positional release therapy and PNF stretching. And we're also going to be comparing to see which one of those are better. And then more specifically, we're going to be looking for a particular outcome to measure with those two treatments. And that is going to see if we can actually reduce the amount of disability that the athlete is experiencing and hopefully try to increase the flexibility deficits that they may be experiencing. So when we organize this and put all of the components together that we see, we come up with the full question, which states, is positional release therapy better than PNF stretching when it's used to improve the flexibility and decrease disability in athletes with chronic or recurrent hamstring injuries? Okay, so again, you guys are going to be looking to compare PRT to PNF. Okay, so as we look at the clinical plan and how we actually develop and implement this type of study, we have to first address what type of study design that we're going to use. In this particular instance, the study design that seemed best fit was to use a point of care clinical trial. It's a relatively new design and research as it is used and compared to more common types of study designs. It's going to be used heavily in bench research or research that is actually conducted in the practicing setting. And then it also combines the components of well-known randomized control trials. But it also has that additive effect of observational studies where we get to see our treatments and our results and outcomes happening in real time in real life settings. So that's what makes this unique and probably more practical to what we're looking at. In this particular study, we're going to want to look at including high school and collegiate athletes. And we want to make sure that we define our criteria, especially when we're looking at chronic injuries. We're, in this instance, defining it as being 2 weeks or older. And we're also going to look at defining what recurrent hamstring injuries are. And that's going to be any hamstring injury that is happening in the ipsilateral side of the previously injured hamstring. And that would take place anywhere from 2 weeks to 16 months post return to play from the previous injury. Okay? So in this particular study design, there is always going to be what is called random assignment using the Bayesian approach. And the brief overview of the Bayesian approach is going to look at seeing which treatment is producing the best outcomes along the study. And as you start to see better outcomes, you're going to actually move your patient population in percentage format to the better treatment group and see if your results are still consistently producing improvement in that particular athlete. Okay, so the measurable outcomes, again, that we already addressed before, that we're going to be looking at is, again, increased flexibility. We're also going to look to see if some range of motion improves. So that specifically looks at knee extension and passive hip flexion to see if we can put that muscle on stretch and get it to move a little bit better. And when you're trying to implement a study of this caliber in your own setting, there are going to be a few challenges that are always going to arise, and that's with any study. Anytime you're doing anything of this nature, you're always going to have possibilities of lacking knowledge or full understanding of how your treatments fully work. So that's what the point of the research is, to see how those things play out. Always going to be challenges with time management and trying to see if you can actually conduct it in true athletic training practice. We all know that time is of the essence in our practice, so trying to do something like this, we're going to find out how feasible it is. And then, of course, having the support and the resources that you need to implement something of this caliber. So if you are trying to do this, make sure that you foresee all the challenges that could arise and try to devise a plan to overcome those barriers so that you don't have many of those issues when you're doing it on your own. Okay. More specifically with this project, you're often going to have instances where consistencies become a challenge. And that's going to be consistency in measurements. So you want to make sure that you're prepared to make the same measurements at the same time, using the same people if possible, and just making sure that your checkpoints are in the same location at all times. Consistency is key. And then one other problem that will tend to rise is how to effectively produce that random assignment that we described earlier using that Bayesian approach in point-of-care clinical trials. So a big solution to this is to make sure that you understand what you're doing, understand which treatment is actually producing better outcomes along the way, so you know how to make your clinical decision and actually continue to use the treatment that is proving to be more effective. Last but not least, just something to include whenever you're working with athletes, and especially in point-of-care research, is you want to have an infographic that is giving the patient or the athlete brief information, basic information of their injury and the type of treatments that they can expect to receive. The more knowledgeable your athlete or your patient is, the more comfortable they feel with the treatments that they are going to receive from you, and the more knowledgeable they are to make informed decisions about how to proceed with care of their own bodies. So this is something that you're going to always want to try to have available for those people that you're dealing with, just so they can have something to look at. Well, I hope you guys got a basic understanding of how to compare the effectiveness of two common treatments for hamstring injuries, and I look forward to hearing your feedback. Thank you for your time.